This presentation will demonstrate steps on how to insert a new Eversense sensor and remove a previous sensor. It is intended as a training supplement only and is not a substitute for training with your authorized Eversense trainer. When performing an insertion and removal procedure on the same patient, the insertion is performed first. Also, make sure the new insertion is performed in the opposite arm. Before you begin, gather all of the necessary supplies and verify that none have passed their expiration date. Also, check that none of the supplies or supply packaging have been damaged or opened. Make sure you've reviewed the warnings and precautions in the Eversense CGM sensor insertion and removal instructions. Arrange to have an assistant available during the procedure, and reserve a clinical area with a flat exam table or bed. Confirm that your patient does not plan to have an MRI for the duration of the sensor wear, and ensure that your patient does not have allergies to the approved antiseptic or anesthetic that will be used during the procedures. If you have a cough or a cold, wear a mask. Once you have thoroughly washed and dried your hands, you are ready to begin. First, open the outer plastic package of the custom procedure kit. Without unwrapping the two packages inside, remove them both from the outer plastic wrap. Keeping the larger package wrapped, place it on a clean, flat work surface. This is where you'll create your sterile field. Next, place and open the smaller package of non-sterile items alongside the insertion tool and sensor boxes. With your patient seated on the procedure table, position the smart transmitter on the lateral area of the patient's arm below the deltoid. You want to select an insertion location for the smart transmitter that is comfortable to wear 24/7 for months and be easily accessible for the patient to reach. Also, consider the patient's lifestyle, hobbies, activities, and sports when selecting where the patient will wear the smart transmitter for the months ahead. Once you've selected the position, hold the smart transmitter in place and mark the edges on the skin with a surgical marker. Place the non-sterile incision template inside the marked lines. Mark the horizontal and vertical lines on the skin. The horizontal smaller line indicates the incision location. The longer vertical line indicates the sensor pocket path and should be parallel to the humerus bone. Next, position the patient in a lateral recumbent position with the elbow flexed up to 90 degrees and the palm resting on the chest or abdomen. You can place a pillow under the patient's arm and head for comfort. Now it's time to open the larger kit package on the clean, flat surface you designated as the sterile field. Position the kit so that the outer flap faces up and toward you. Then pinch open the outer cover away from you. Open the two sides next. Then, open the last flap toward you. Remember, everything inside, including the inside of the drape, is sterile. Wash and dry your hands. Put on sterile gloves and assemble your sterile field with the items contained in the larger kit. Now you're ready to prepare the rest of the sterile field with the help of your assistant. Have your assistant present the insertion toolkit tray to you by peeling back the cover on the outer tray. Remove the sterile inner tray containing the tools and place it in the sterile field. If you touch the outer tray, you must change your gloves. Have your assistant add 10 milliliters of sterile saline solution to the preformed well in the sterile inner tool tray. Your assistant should stand close while not compromising the sterile field and open the pouch containing the sensor holder. Grasp the sensor holder from the wrapper and place it in the sterile field, being careful not to touch the outside of the pouch. release the handles of the tools from the tray, and if necessary, reorient the tool tray to make it easier for you to grasp the tools during the procedure. Now prepare to load the sensor into the insertion tool. To do this, pick up the sensor holder and squeeze the ridged portion with one hand. With your other hand, pull to remove the holder's cap. Next, pick up the insertion tool from the tray. Ensure the blue slide on the insertion tool is in the retracted position. Align the slot of the sensor holder with the slot in front of the slide. Support the tip of the sensor holder as you slide it over the insertion tool's metal cannula until it clicks. In the correct alignment, the small white triangle at the bottom edge of the sensor holder will be pointing to the small blue triangle below the cannula on the insertion tool. Now depress the blue slide down to unlock it. Support the tip of the sensor holder as you advance it all the way forward until it stops. This loads the sensor into the cannula. Keep the blue slide in the forward position. You'll note that the cannula, which now covers the sensor, is visible through the slot in the sensor holder. Next, remove the sensor holder from the insertion tool by squeezing and pulling on its ridged portion. Be sure to visually check that the sensor's tip is nearly flush with the end of the insertion tool. It should not be more than about a millimeter outside the cannula. Use a new sensor if it is improperly loaded or drops out of the insertion tool. Now you need to hydrate the sensor. This is done by snapping the insertion tool back into its original position in the tool tray. Ensure the cannula is submerged in saline and hydrates for approximately 5 minutes. Your assistant can add more saline if needed. Next, prepare the incision site. Using chlorhexidine or betadine, disinfect the site using sterile swabs or gauze. Apply at the planned incision line. Using a circular motion and moving outwardly, disinfect an area larger than the adhesive around the drape's aperture. Allow the disinfectant to dry for 30 seconds after each pass. Repeat for a total of 3 passes using a new swab or gauze each time. With the aperture drape still folded, remove its adhesive backing. Fold the drape in half. Then align the proximal curve of the aperture with the proximal markings of the smart transmitter. Place the aperture of the drape, adhesive side down, over the incision area. Then, carefully open the drape, maintaining sterility. Now, with the help of your assistant, draw up approximately 2.5 milliliters of lidocaine sterilely. Inject the lidocaine 1 milliliter at the incision line and 1 milliliter along the vertical sensor pocket path as follows. Advance the needle into the planned incision line at a 20-degree angle. Aspirate for blood return. If blood appears in the syringe, remove it and redirect the needle, repeating the aspiration step. Then inject the lidocaine while slowly withdrawing the needle along the planned incision line. Remove the syringe from the incision line and insert it at the distal end of the vertical sensor pocket path. Aspirate for blood return. Again, if blood appears in the syringe, remove and redirect the needle, repeating the aspiration step. Inject the lidocaine while slowly withdrawing the needle along the planned vertical sensor pocket path. Place the syringe in the sterile field and gently scoop its cover back on. Now you need to make certain the insertion area is fully anesthetized, which typically takes 1 to 2 minutes. With the tip of the scalpel, tap several points of the planned incision line and vertical sensor pocket path. Ask your patient if he or she can feel anything other than pressure. If yes, wait another minute or 2 prior to checking again. Inject more lidocaine at this point if necessary, while still maintaining sterile technique. Explain to your patient to tell you to stop if pain is felt at any time. Once the area is anesthetized, you'll make an incision approximately 5 millimeters in length, which is the approximate width of the number 15 scalpel at its belly. The depth of the incision is 3 to 5 millimeters, which is approximately the distance from a number 15 scalpel's tip to its belly. Holding the number 15 scalpel with the pencil grip, punch the belly of the blade into the dermis. You may feel and hear a pop. Use the belly of the blade to make one clean 5 millimeter incision medially. Remove the blade from the incision, turn it 180 degrees, reinsert into the incision, and slightly advance it laterally. Turning the blade once ensures that the 5 millimeter incision is uniform from edge to edge. Place the scalpel back in the sterile field. Use sterile gauze and apply pressure to the incision site to control any bleeding. Now remove the custom blunt dissector from the tray. Hold it with your dominant hand as shown. Ensure your fingers are not under the metal rod or plastic portion of the tool. Introduce the blunt dissector to the middle of the incision line at a 45-degree angle so that it follows the vertical line you drew for the sensor pocket path. Note that the tip and tapered portion of the blunt dissector should be within the incision, and the tips of the depth guards should make contact with the skin. Next, drop the angle of the tool flat to the skin. Keep your fingers on top of the blunt dissector. The depth guards should rest on the skin without any gap. Advance the blunt dissector its entire length. A slight amount of rotation around the center axis of the tool may be necessary to advance it, but don't fishtail with your hand as you advance the tool. You can re-advance the blunt dissector to ensure adequate pocket creation. Remove the blunt dissector and return it to the insertion tool tray. Use sterile gauze and apply pressure to control bleeding if necessary after creating the pocket. Next, with your dominant hand, pick up the insertion tool loaded with the hydrated sensor. Keep your fingers on the sides of the tool and avoid touching the blue slide. Using the same 45-degree entry angle used with the blunt dissector, place the tip of the insertion tool into the incision opening so that the tip of the cannula enters the incision. Drop the angle of the insertion tool flat to the skin and advance it into the pocket that was created by the custom blunt dissector. Do not use excessive force to advance the insertion tool into the pocket. If the incision needs to be larger, remove the insertion tool and return it to the insertion tool tray. Use the blunt dissector again, and then reinsert the insertion tool. If necessary, the incision can be widened slightly with the scalpel. Now advance the insertion tool following the same vertical line as the blunt dissector until the incision line is between the first and second marked lines on the cannula. Just before you deploy the sensor, stabilize the tool with your dominant hand. Being careful not to dislodge the tool from the incision line, use your other hand to depress the back of the blue slide to unlock it. Then, push the blue slide away from the incision to retract the cannula, leaving the sensor in the pocket. The blue slide locks into place when it is fully retracted. Keep it in this retracted position. Now you may remove the insertion tool from the incision. Visually check the end of the tool to ensure the sensor is not still in the tool. Then return the tool back to the tray. If the sensor is still in the tool, discard the sensor and the tool, and repeat all steps starting with opening a new large kit. Apply gentle pressure to the incision line with sterile gauze for several minutes to stop any bleeding. Once the incision area is dry, gently align the edges of the incision together and place 3 steri-strips across the incision line. The steri-strips should lie flat and not gap to ensure the best healing of the incision. If desired, place 2 additional steri-strips perpendicular to those just placed. Place sterile gauze over the steri-strips and hold it in place while removing the drape with aperture. Then apply a padded tegaderm over the steri-strips. Avoid touching the patient's skin while applying tegaderm. Retain your syringe containing approximately 0.5 milliliters of lidocaine in the sterile field for the removal procedure. Now dispose of your used insertion tool, blunt dissector, and used scalpel in accordance with your administrative policy. Last, remove your sterile gloves and begin preparing your patient for sensor removal. Begin the removal of the Eversense sensor by positioning your patient in a lateral recumbent position, with the elbow flexed up to 90 degrees and the palm resting on the chest or abdomen. You can place a pillow under the patient's arm and head for comfort. Have your assistant locate the sensor with the placement guide in the Eversense mobile app. Have the patient use his or her smart transmitter and placement guide to find the sensor's greatest signal strength. Mark the edges of the smart transmitter at this location with the surgical marker found in the smaller kit package. Use your senses of sight and touch to locate the sensor. The following tips may help. Look for the original incision line and then palpate above it to locate the sensor. Or use your index fingers or thumbs to gently press on the skin at the sensor's expected site to locate it. It may be helpful to close your eyes and use a sliding motion over the expected location. This may enhance your sense of touch and help you identify the sensor's location. Also, have the patient flex the triceps and rotate the arm to help you locate the sensor. Once identified, use your surgical marker to trace around the sensor's location. Mark the planned incision line. If the sensor's distal end is within 3 millimeters of the original incision line, consider using the same line for the removal. But if the original incision line isn't visible or is more than 3 millimeters away from the sensor's distal end, mark a new incision line for the removal. This would be 1 to 2 millimeters below the sensor's distal end. If, however, you're unable to palpate and mark the location of the sensor, you'll need to speak with your authorized Eversense trainer for further guidance. Once you've marked the planned incision line for the sensor removal, follow these next steps. Wash your hands. Put on sterile gloves. Organize your tools and place them in order of use. Loosen the cap on the syringe. Remove the scalpel guard and unlock the clamp. Now you're ready to prepare the incision site. Using chlorhexidine or betadine, disinfect the site using sterile swabs or gauze. Apply at the planned incision line. Using a circular motion and moving outwardly, disinfect an area larger than the adhesive around the drape's aperture. Allow the disinfectant to dry for 30 seconds. Repeat for a total of 3 passes using a new swab or gauze each time. With the aperture of the second drape still folded, remove its adhesive backing and fold it in half. Align the proximal curve of the aperture with the proximal markings of the smart transmitter. Place the aperture of the drape, adhesive side down, over the incision area. Then carefully open the drape, maintaining sterility. With your non-dominant hand, push down the sensor's proximal end to stabilize it. It's important to maintain constant contact with the sensor's proximal end until the sensor is removed. With your dominant hand, pick up the syringe containing lidocaine from the sterile field. Insert the syringe needle at the planned incision line at a 20-degree angle, aspirating for blood return. Remember, if blood appears in the syringe, you'll need to remove and redirect the needle, repeating the aspiration step. Inject 0.5 milliliters of lidocaine at the planned incision site while slowly withdrawing the needle. While continuing to maintain contact with the sensor's proximal end, check that the removal area is fully anesthetized, which typically takes 1 to 2 minutes. With the tip of the scalpel, tap several points of the planned incision line and removal area. Ask the patient if he or she can feel anything other than pressure. If yes, wait another minute or two prior to checking again. Inject more lidocaine at this point if necessary, while maintaining sterile technique. Explain to your patient to tell you to stop if pain is felt at any time. Holding the number 15 scalpel with the pencil grip, punch the belly of the blade into the dermis. You may feel and hear a pop. Use the belly of the blade to make one clean 5 to 6 millimeter incision medially. Remove the blade from the incision. Turn it 180 degrees. Reinsert into the incision and advance it laterally. This ensures that the 5 to 6 millimeter incision is uniform from edge to edge. Then return the scalpel to the sterile field. Next, take your clamp and advance it through the incision with your hand facing down and the clamp jaws closed until you touch the end of the sensor. Listen and feel for the clamp touching the end of the sensor. Once you locate the sensor, open the clamp, advance it a few millimeters, and then gently close the clamp to secure the sensor. Once secured, do not lose your grasp of the sensor and the clamp. Do not, however, use the locking mechanism. Instead, use gentle pressure to secure the sensor, then withdraw the clamp and sensor from the incision line. If you experience any resistance, gently rotate the clamp with the secured sensor to release any small fibrous tissue. Then apply gentle pressure to the incision line with sterile gauze for several minutes to stop any bleeding. Once the incision area is dry, gently align the edges of the incision together and place 3 steri-strips across the incision line. If desired, place 2 additional steri-strips perpendicular to those just placed. The steri-strips should lie flat and not gap to ensure the best healing of the incision. Place sterile gauze over the steri-strips and hold it in place while removing the drape with aperture. Then apply a padded tegaderm over the steri-strips. You may now remove your sterile gloves. Instruct your patient on incision care and to call your office should any potential adverse events occur. Give the patient the written take-home instructions. And remember to make sure that the patient's newly inserted sensor is linked and in the warm-up phase prior to leaving the office. For more information about the Eversense insertion and removal procedure, please visit our website at eversensediabetes.com. You may also contact your authorized Eversense trainer.